Also big tonight, a Pan-American health official has suggested that Grenada move to decriminalize attempted suicide. Dr. Renato Oliveira y Souza made the comment in St. George's on Friday in a meeting with the island's Minister of Mental Health, Delma Thomas, and Acting Health Minister Andy Williams.
We are aware that Grenada is one of the 4 countries in the region of the Americas, we have 35, where suicide is considered, attempted suicide is considered a crime. Only 4 countries in the Americas. So if you could review that and work towards decriminalizing suicide, that's another big message that you pass to the population to destigmatize. Because why someone in suffering, in distress, that not finding another situation attempts suicide should be criminalized? That person needs care.
Grenadian Minister Thomas assured the PAHO delegation that the issue is on the government's radar.
I want to say to you that we are committed to reviewing that. If we're seriously talking about mental health issues, then this is a mental health issue. So how can you, victimize might be a word to use, how do you victimize someone for their illness? Because you are sick, you are depressed, this is a result of being sick. So we as a government will work on this as fast as possible in terms of looking at our legislation and how we will work to change it in fast order will be part of what we prioritize as a government. So,
Dr. Oliveira y Souza said PAHO is willing to help with the process.
We have helped other countries to do that. We are ready to help you on the same way that we have done.
In a related development, the Pan-American Health Organization Unit Chief on Mental Health says there is a unique opportunity in Grenada for advancing the quality of mental health there. Dr. Renato Oliveira y Souza said in St. George's on Friday that he senses the government is committed to giving it the attention it deserves.
There are unique opportunities in this moment in Grenada for advancing mental health. And why there is such a unique opportunity? Because the country has shown value and commitment towards mental health, has really put mental health at the top of the national agenda.
Dr. Oliveira y Souza was reporting after a week-long in-country visit by PAHO officials to help assess the country's health services as the government pushes for massive improvements in the sector. During their visit, the PAHO officials on Monday met with more than 24 of Grenada's top healthcare professionals, including the Chief Medical Officer, the Chief Nursing Officer, Director of Hospital Services, among others. Dr. Oliveira y Souza said there is a clear indication that the Dickon Mitchell administration is ready to provide funding and other support to create an environment for the improvement in mental health services.
You have not only elevated the importance, but Grenada has also allocated human and financial resources to advance the mental health system. So I would really like to congratulate you again for doing that. And by doing that, you basically create an environment where many things could be improved for the well-being of the population of Grenada.
Only last year, for the first time in its history, the Grenada government established a ministry for mental health. The new minister is Delma Thomas.
If, as you look at the Monge Mental Hospital, you realize we need specialized training in dealing with those issues that confront us. You look at the system that is available, and it's not for human consumption. So we know that there's a lot of work to be done, but we, as a government, we are committed to dealing with the challenges.
Among the things the PAHO official identified was what he described as the insufficient integration of mental health care into the general health system.
And because of that insufficient integration, clear problems appear. Low access to care for the population to access mental health, poor quality of care in many situations. This perpetuates stigma. And on top of that, it's important that I also mention to you that there are conditions that we have observed that are not in line with recovery and human rights approaches.